Dr. Ricardo Hanel of Baptist Health.
Good morning, everybody. I think I'm the last, or one of the last things in between you and your rest of your day. So I'll try to stick to my 10 minutes here. Thank you, Jax USA. Thank you, Michael Mayo and the Baptist family for allowing me to showcase what we have been doing in the last 8 years. I'm a neurosurgeon. I do use the saw, but I use the catheters as well. What you guys don't know, Dr. Garaz is afraid of blood, that's why he doesn't use the saw. So this is our house. Those are my disclosures, and naturally this is teamwork. Thankfully, we're past the time this is a one-man show. This is a big village that takes care of people that come with a stroke or cerebrovascular problems through Baptist. And I'm a big believer that we have to balance this with education, patient care, and research is a centerpiece. And I love the idea of bringing this innovation. I learned so many things about what's going on in our community here today, and I'm thankful for that. We joined Baptist in 2014, and stroke and cerebrovascular was not existent as a program there. And since then, we blossomed into a tremendous stroke and cerebrovascular. We have the busiest stroke and cerebrovascular program in the state of Florida. We have top 10 programs in the country. And we're currently enrolling 39 clinical studies with many lines that I'll show you in a second. Our research is sponsored from the NIH to local sponsor through philanthropy, among others. Very excited to be one of the 20 centers that are going to start. Again, we copy a lot of our concepts from cardiology. This concept of MDIC, Medical Device Innovation Consortium, where we have FDA, CMS, the hospitals, and industry together to try to bring technology that is started in the United States, instead of going all US to be first in man or feasibility studies, bring those studies to the United States. And here in Jacksonville, we're going to be doing that. We have research lines in system of care and stroke. I'm very proud to say, in terms of door to recanalization, in somebody that comes with a clot on the brain, they will have to fish the clot out. We have best numbers in the country. We have a very interesting program in decreasing the gap, and some of you talk about that. If you live at 32209, it's very different than if you live at 32082. And it is our mission, everybody in this room, it's your job to fix that. This is on us, and we need to map the problem and go after the problem. Neuroprotection for acute stroke, new device for acute stroke treatment. We have many tools that were first in the world, first in the country, first in the state. New drugs to treat stroke, new device for minimally invasive treatment, stroke prevention, and simulation, among others. I'm going to focus in 2 projects. We cannot talk about everything, but a brain aneurysm is a bubble in a blood vessel. And if you have 300 people in the room, 12 of us have a brain aneurysm here without knowing. And if, God forbid, that burst, you have a 40% chance of dying and a 40% chance of being disabled for life. And you don't know about that. If you go to your primary care physician, they don't even ask you, do you have a family history of brain aneurysm in your family? You go through a whole list of things. Do you have breast cancer in the family? Do you have colon cancer in the family? Do you have diabetes? Do you have high blood pressure? They don't even ask you. So awareness is a big problem, and it's our job to fix that. If you smoke, you're higher risk, but we talk about family history, and that's what we're focusing with the support of state of Florida. I gave you the 4% number, the statistics of 300 people in this room with the 12 of us harboring one of those. But if you have, my mom had an aneurysm or my father had an aneurysm, you get a 50% bonus. That's why I joke with my patients in a bad joke, naturally. If you have 2 family degree members, you double your odds of having a brain aneurysm. And nobody asks you at a primary care physician consultation. Why? We don't ask. Because 20 years ago, all that we had was the saw. And to crack somebody's head open to fix a brain aneurysm was a very invasive procedure with potential downside of that. So leave them alone. We don't have a good way to fix. Fast forward 20 years, if you think about your cell phone 20 years ago and think about your cell phone now, we came a long way. and just all these beautiful, minimally invasive procedures that are showcased here, we have the same. We call this drive-through brain surgery. Just like Dr. Garaz illustrated drive-through cardiac surgery. What he's doing to the valve is cardiac surgery, but he doesn't have to open the chest. So that's an evolution of that, and we have exactly the same thing for brain aneurysms. So what we're doing, we start the Florida Familial Brain Aneurysm Study, where anybody that has an aneurysm is now supported by Florida State and Baptist Health to be screened, get the family screen, any first-degree relative for those families. What we're trying to do is first to map, is this 4% number real in North Florida, South Georgia? And these people are donating a blood sample, and the same genomic DNA and RNA that Jennifer shared with us for breast cancer, this is there for aneurysms too. Can we map these genes, and can we come with a nice blood sample study instead of putting these people through a very expensive, elaborated MRA? Can we do a blood screening and get a blood test, your odds of having this aneurysm, just like if you have a gene in your family that maps that you're higher risk for a breast cancer. So this is going there. We started this study, and it's going really well, and I hopefully I'll report to you the results in the near future. We're hoping to get from this, again, the map of Florida, South Georgia, and hopefully genetic testing for brain aneurysms. And this is coming right here from Jacksonville. Another one that's very dear to my heart is training. If you haven't read this book, I strongly recommend. Malcolm Gladwell talked about deliberate practice. And if you know about what we do with surgery, it's very different. If you're a virtuoso violin player, 10,000 hours practicing. If you do surgery, it's a see one, do one, teach one. And that started like that, and for those of our laughing in the room that are surgeons, that remains the same. You watch as an intern, can I get this central line? Yes, let's do it. So I think we came a long way from that, and we need to invest on that. Very happy to have different models to measure what these trainees are doing. We have a training center with 2 clinical fellows every year coming from Pittsburgh, Emory, Mayo, Barrow, from all over the world to learn here in Jacksonville how to get this device. And we're measuring what's the effect of putting a trainee to this virtual simulation, just like we just saw beautifully illustrated for rehab. This is there for training too. So this is our test patient, made in New York. So you have the heart, you have the vessels, so you can simulate in 3D print exactly what we're doing with that. And this is a model from one of our patients. We did the first in the country with a specific tool to change the flow on that aneurysm. The bubble that you see right there is the aneurysm. You go from inside without the saw, just with a puncture on the wrist or the groin, and we'll go and fix that. We can do this patient-specific. So this is an example of an 8-year boy with a very complex problem of an aneurysm that we don't even have the tools available in the United States to treat this kid. So I have to use a tool that I don't have much experience in a very frail situation, an 8-year-old boy with smaller vessels. So what we did what is called compassionate use of a device through the FDA. We work with the agency to get the device approved to bring to the country. It's approved in Europe, so we import the product. But before me exposing this patient to a high-risk procedure, I'm going to get better in doing that. So the day before, I'm there, and I'm training that specific procedure on his 3D printed aneurysm before I treat this patient. So and that's what we did. Thankfully, that went very successful and helped him carry on with his normal life. This is measured, this is publishable, and this is teachable. You bring people to a higher level of confidence, decrease error, decrease complications, decrease procedure time. We do this on the open surgical arena too. The saw is still very useful, and we need that sometimes. So we do that on that arena as well. And again, It's beautiful to see showcase here human knowledge exploding, and this is on the best interest of each one of us. There is a potential patient for that. I congratulate the JAX USA for putting this together. Definitely we need to bring innovation to Jacksonville, and I'm glad to be involved on behalf of Baptist on this conference. The golden goal is to treat everybody that comes through your door with the best possible ability. We saw this here with every single presenter, and I'm proud to be one of them. Thank you, guys.